You are now listening to the Building with AI Promises and Heartbreaks podcast, brought to you by Solid.
Welcome, everybody, to another episode of Building with AI Promises and Heartbreaks. Today, I have Preeti Vaidya with me on the episode. Good to see you, Preeti.
Hi, Annie. Thanks for having me here. Excited to have this conversation.
Thank you. Thank you for joining. So, for the audience here, let's maybe start with a brief introduction of yourself. What's your current role? Where are you at? And then also, what's Morgan Health, which you're going to talk about in a moment.
Certainly. So I'm Preeti. I work at Morgan Health, a part of JB Morgan Chase. I'm focused on the AI component of it. So individuals who are covered by employer-sponsored insurance are in locations that are geographically distributed. They have different socioeconomic status. There are so many things that differentiate them. And to improve outcomes for all of them requires something that kind of brings them all together, regardless of where they are, gives them access to the same care, regardless of their geographic location, regardless of like their socioeconomic status, the zip code that they're in. And AI is that sort of promising capability that we have access to in the times that we live in today that can be that great equalizer, make sure that everybody has access to the same quality of care, regardless of where they are. So I sit at that intersection of like ESI and AI and really thinking through how to deploy AI that actually works in clinical settings and also really makes a difference in people's lives. So in order to do that, I kind of work with our portfolio companies. We've invested in companies that are really moving the needle forward in this space. And I get to talk to them and think about like how they're going to improve outcomes for individuals, as well as like the types of tools that they're deploying. How do they measure impact? What are the challenges that they're facing? And what are the things that they can do to drive adoptions? What is working? What's not working? So interesting sort of intersection to be at, and really the time to do it is now in some ways.
Okay. So, JP Morgan, which is, we
Yes.
all know as a really big financial institution in the United States and obviously in the news and so forth, but very, very big and important, decided that they want to have some sub entity, call it Morgan Health, that is focused on improving healthcare for people who are getting healthcare insurance from employers. So, for example, you and I, we get our insurance from our employers. I can tell you solid. Our employees they get health insurance and so forth. 160 million people in the U.S. are covered by employer-sponsored healthcare, and so
And
J.P. Morgan
counting.
decided. Well, sorry,
And counting.
and counting. And so J.P. Morgan decided, let's make their lives better, which is amazing, by the way, to start from that. And then what you're saying is data AI is here, and JP Morgan as an organization that is very tech forward is thinking of, okay, how do I leverage this? How do we make people's lives better? And you got the amazing opportunity of looking and sitting at that intersection of data and AI in this endeavor, right? That's kind of the right way to think about it. Did I get it right?
Absolutely. Thank you so much for putting it that way. I definitely love my job more than we started this conversation.
Yeah, listen, I'm a founder. What I do is sell. I sell all the time. So I can even sell people's jobs back to them. Maybe charge a premium on the way.
No, that definitely is an interesting challenge. And what makes it interesting is like all of the above things that you said, right? Like the space that we're operating in, which was ESI,
Mhm. What
covers
is
more.
ESI?
Sorry,
What is ESI?
employer-sponsored insurance.
Okay.
That's
Okay.
really it.
Yeah.
The lives that we cover, which is like more than half of Americans, are kind of in this space of ESI. But it's
Mhm.
also JP Morgan Chase employees, right? So it's all driven by this idea that we want to make lives better and healthcare outcomes better for our own employees. And in doing so, if there are things that we think can really change the industry at large, the ESI space, and move the needle for everybody in this space and not just us. We want to be able to share our findings out. We want to be able to share what works, what doesn't work. So that's really sort of the crux of it. It's in this space of like really improving outcomes for everybody and not just ourselves and our employees. So that's like a big focus of what we do.
Okay. So now we can take the AI conversation here in a number of different directions because we talked a bit about it before. So there's the AI that gets used internally by employees at Morgan Health, et cetera, and AI that gets used by the companies under Morgan Health, and then there's AI in general in the healthcare. So we're going to take this conversation in multiple AI avenues.
Mhm.
So let's maybe start with this. Internal people at Morgan Health that are looking to use AI for making better decisions, for example. Let's talk about them for a second. One of the things we talked about as we were preparing for this meeting, you said there's this desire to have everyone use AI.
Yes.
But there are the challenge of how do you get non-technical users to use AI effectively?
Hmm.
Um, you talked a bit about the concept of canary power users,
Canary.
canary. So let's dig into that for a second. That's one of the topics I'm really interested in. So, what has been your experience in trying to get the non-technical users to use AI, and how did you help bridge that gap?
That's a great question. And I think that's a challenge faced by everybody in the industry right now, and not just like folks here at Morgan Health, but just generally, if you think about it, for everyone to use AI, we are assuming a baseline level of understanding of how AI works,
Hmm.
the understanding of the tools that you're given and how to get the right outputs from them, and then see the ability to then translate all of the above and create effective prompts or sort of interaction points with those technologies that then give you the output that you need.
Hmm.
That's a lot to ask of any user. And
Yes.
that comes very intuitively to your power users, to your Canary users, to the people who are actually motivated to try this technology. And the truth is, these are the users who are not just the Canary users for your AI program, they're the Canary users for all of your technology programs. They're
Hmm.
excited about technology, they're excited about like any new tool that's coming out in the market that could perhaps improve their workflow. They're the ones who are probably coming to you to say like, "Hey, can I have access to that tool?" Or, "By the way, I
Hmm.
tried this outside the firm and it worked, and can I, have it inside the firm?" And so it's not very hard to motivate these individuals or demonstrate quote unquote success with these
Hmm.
individuals because they're already motivated to do so. They have the understanding and are really like kind of ahead of the curve. The problem really starts happening in translating the successes of these early pilots that you've launched with these Canary users and taking it to the average user, to everybody else who are like kind of across the adoption curve and on varying degrees of like maturity in terms of understanding the technology, as well as like willingness to engage with new technology, right? Some people come very happily and others come screaming, but the mandate of our times is that everybody should use AI because there's this perceived notion that AI is going to give you this competitive edge and give you all the advantages that if you don't, the term that is in the industry right now, AI is not going to take your jobs, but the person who uses
Hmm.
AI effectively will. Like
Hmm.
that's the times that we're living in. Those are the pressures of businesses, individuals, professionals of our time. So with that sort of mandate and making sure AI scales to everybody, everybody uses AI, the challenge ends up being that we end up facing is that the tools that and the POCs that work for the Canary users are not actually designed for your average user. Your average user doesn't really need like a chat interface because when you give them a thinking chat GPT, right? You give chat GPT to everybody, but you cannot ascertain the outcome that they'll get out of it. So it
Hmm.
largely depends on like upskilling of the individual. It depends on like how individuals like kind of are able to prompt and assess the outputs that they're getting. So there are many barriers that somebody who is not like doesn't have that baseline understanding in using tools such as like LLMs or your Claudes and Perplexities and all the new tools that are coming out. And so the way we're thinking about it and the way I think we can kind of streamline this problem and make sure that everybody can kind of benefit from AI across the board without having to like really upskill themselves to a point where they're now the experts of AI and you have like lost all of this time and a new technology is already, on its way and now you need to upskill on that is to integrate AI into people's workflows. And by that, I don't mean like give someone a nurse in the ER, a chatbot to have conversations with. I mean,
Hmm.
give the nurse clear input from AI systems that then she can overlay into her caregiving, into the way she thinks about interacting with the patient at the right, like, kind of intersections of our workflow. So, for instance, if there is like a marker that is increased that she needs to look at for a critical patient, she's notified, she's able to go and have that conversation rather than her having to then now talk to a chatbot, or not a chatbot, but like a conversational AI tool that then she has to really largely rely on her understanding of AI to then interpret what the model does, whether the model is giving her the appropriate answers, or whether or not it's hallucinating and all of the other things that models can do. So, really meeting people where they are instead of like asking them to then walk a journey of 1,000 miles in like a few days and then measure them on not being able to do it effectively. And that's where I think programs are failing. There's a lot there.
So,
So yeah,
yes. So if I unpack that, you're basically saying this.
yes.
The original form of consumption for us for Gen AI, what we all call AI now, but Gen AI was ChatGPT. That's how it started, right? 3.5 years ago, that's what we got accustomed to.
Can you
In a
believe
lot
it?
of,
3.5 years have
yeah, it's
already
crazy.
gone by. Yeah,
It actually feels like 3 decades a bit.
that's fair. That's fair.
Things have been running. So people got accustomed to that. And a lot of times when people think about AI, they think about ChatGPT, they think about Claude, etc. And your point is, well, not everyone knows how to prompt these chats really well. And also, that's not necessarily the way that they want to interact with it in their settings and where they are, especially, a nurse that is treating patients and they're coming in one by one, you don't want to start chatting and be like, hey, hello. Jane came into the clinic today. Jane complained about this. And like, the nurse is going to start typing all this and how's this even going to work? So your point is it needs to meet them where they are. It needs to sort of slipstream into their existing experience,
Right.
into how they're currently working. I have a parallel to this. So at Solid, we're working with a tax authority, and the tax authority, they have people who are reviewing tax submissions, like the records, the cases. And those people also, they don't want to sit and chat. They want something sort of to bring it all to them. So they're building like this sort of cockpit where this person goes in the morning and it tells them, here are the 17 cases I want you to look at today. And when you click on them, you get the full, AI summary of this is what the case is about, etc. But the experience is not one where they chat. The experience is one where AI is brought into the flow that they already want. So the point you're making makes a ton of sense. So now I guess, how do you operationalize that? So once you reach a conclusion of, okay, AI needs to meet them where they are at, where they are living, where they are serving, your customers, your patients and so forth. How do you do that? Do you now go to people who are developing those applications and put it in there? Like, how does that even work?
I think there's like um a bunch of ways in which this could be operationalized. The approach that we're taking is basically starts with like mapping the workflow today,
Mhm.
because not everybody knows what inevitably there's like sort of like a pattern in chaos. And
Mhm.
in order to find points where AI can improve your workflows, you need to start with knowing what the workflow is.
Mhm.
So having conversations with the individuals whose workflows you're targeting, not trying to like look at the whole universe at once, like kind of focusing on the piece of the pie that makes sense to focus on, and then progressively kind of building from there. So having the conversations, mapping people's workflows, and then identifying areas of like enhancements. We're not relying on your Canary users or power users entirely to define the areas of improvements, but also like kind of going and having those conversations with the tools that the individuals for whom the tools are being designed for, I think is going to be critical. So in that way, not treating AI differently from like product development,
Mhm.
but just realizing that it's going to be a series of solutions. The enhancement is going to be in the workflow and not a tool that you put out there, which could be through a tool, but really targeting those workflows is kind of getting the crux of it. So for example, some of the workflows in AI that are in healthcare that are really working are like really thinking about like imaging, like radiology reports, assisting radiologists in making decisions, where like you have those conversations with the radiologist or with that nurse on the emergency room floor, or that physician who has to round like 20 patients every day because there's a shortage of doctors. And that's our reality that we live in. So, really trying to understand their workflows, their pain points, what they want to be focused on, and then kind of as an expert, then bringing in your sort of AI experts that can help map where AI can fit in, where are the targeted solutions that can be deployed. So, all of the classic things, right? Like no sort of alert fatigue for the end
Mhm.
consumer, making sure like they understand the outcomes. And the thing is that really, as a designer of these types of solutions, really keeping in mind that what is at stake here, right? Like it's people's lives. It's not like maybe the model was like this much, like
Yeah. No.
99% accurate, but like what is the policy of that 1% here? What's the outcome of that? And that shouldn't, in my opinion, be like a limiting factor, or for some people, it can be like paralyzing of like, oh, wait, if I get it wrong these many times, like that's the end of the world. In some ways, it's like, like with great models comes great responsibility, but also aiding the individuals using your models to make the right decisions in a way that is less sharp and more like explainable to the individuals using them in a language that they understand. So then they can take those insights and make actionable decisions, I think really help. So thinking of AI like not driving the workflow, but augmenting the workflow so that the
Mhm.
clinical decision support, not clinical decision maker, but then
Mhm.
still empowering your decision makers in a language that they understand to make the right choices in a much faster turnaround time, which ultimately will like kind of bridge that gap of like with AI, without AI, you're saving more lives basically.
Yeah, which is a really, really important goal. And it makes sense because I use ChatGPT all the time to analyze my blood work and, I wake up with a pain in my finger and I go to ChatGPT, what could this mean? It's like Dr. Google, but, chat. And I don't think I should rely on chat to make life changing decisions, but it's nice to help me think through something. So I can imagine how, if I were to go to a doctor or nurse, I would want them to make the decision and I would be happy for them to leverage AI to help them make the decision. But the decision is still made by the human. The human still needs to make the decision, still makes the call. They're still accountable to it. So that makes sense. Do you have
You
one word?
actually,
Yeah, go
sorry,
ahead.
you actually raised a really good point of like, we're already doing this in some ways, right? Like AI in healthcare for clinical decision support, not just for the physicians, but for the patients, is already happening. So I think it's like, in some ways, like in our best interest to operationalize it in ways that is makes sense, is like
Mhm.
viable, and not like a quote unquote, to use a technical term, overload technology that has not been designed for healthcare to answer questions that are like healthcare specific. There's like great movement happening in this space as well. So like your big Gen AI providers are really starting to build out like AI specific models for healthcare specific models for AI that really like are HIPAA secure, have all of the parameters in place, and like more sensitivity to making sure it's not giving you like inappropriate advice. Because there is a tendency sometimes, like depending on your prompting, for the models to be more agreeable with you, or not depending on like
Yep.
the model. So like not to like, you know, if you ask, do I have this condition? And the model is like, you're absolutely right. You have this condition. And more
Yes.
so like kind of curating those sets of models that are actually like meaningful for navigation for a patient are huge and extremely powerful, because if you think about it, a patient starts with like a diagnosis or a set of symptoms, as you were describing.
Hmm.
And then they have to go speak to a provider and then maybe an expert. And then they have to figure out whether their insurance covers this or not, and how much, and which providers should they go to, and like which company should they talk to for like this, that, and the other sort of medication, which is specialized. Are there any controlled trials that they can be a part of that can help get them access to the best medication out there, or like experimental medication that can help improve outcomes for them? And this is extremely tough to do by yourself. So inevitably, like an individual will kind of rely, or a patient will rely on AI, will rely on the tools available to them. So care navigation is like a huge space in which AI can really help in ESI, like really helping patients navigate their benefits, even to understand how to make the most of their benefits available to them.
That's uh that's actually really important because I didn't think of that aspect of the full picture of what are all the different things I can do to deal with this, including things that are experimental, as you said. And still a doctor needs to say, yes, this is a fit for you or not. But, exploring the full range of possibilities is something I didn't even think about. Have you seen this work so far? Has there been an implementation where you say, this worked? This is something I can point to and say, yeah, this thing worked? Or is it all very, very early still?
I'm glad you asked because we have a portfolio company and Bold that we've invested in, and they have actually created a chatbot that helps individuals really get access to that type of information where they can find like high quality providers for the types of like kind of care that they're looking for. And it really helps them like kind of navigate the system in those ways. So I think also the unique thing about what they did was it's not just like creating a chatbot that kind of sits by itself. And I use chatbot like interchangeably with like Gen AI systems, but like a bot that just sits by itself. And instead they have tried to find like intersection points where they can integrate the bot into existing communication channels that people are already using. So it meets you like where you are instead of you having to go type somewhere. And that makes it easier for like benefits
Mhm.
administrators to offer something like this as well. So you can integrate it into your internal systems or wherever else, and then people can find it easy to use and easy to access and then navigate the system from right there. So like another example of like removing
Mhm.
friction and not needing somebody to go to a new tool and like really bringing it to where they already are. I think that's huge.
Yeah, I saw that. So Morgan Health invested in Embold a few years ago, and Embold's been around for a few years, but it feels like they've taken this massive scale of working with data and basically built AI capabilities. So it's sort of they came from the data first and then built the AI on top of it, which makes it reliable versus the other way around. Is that a correct way to think about it?
Um, yes, implicitly, I think your models and your outputs and the way you use systems is as good as the data that they're trained on, and
Yeah.
whether the data are like sort of relevant to the problem that you're trying to solve. And in Bold had like all of those key elements in place, and really AI really helped them sort of unlock those capabilities, which is a huge step forward in improving outcomes.
So I like that you talked about outcomes, and I want to think about impact. And there was a couple of impacts. So let's assume these technologies work really well. Let's assume I, as someone who's insured, can now get me, my wife, my kids can get better service, better identification of issues, better ways to deal with them, even experimental in some cases if applicable. And now these doctors or nurses and radiologists, they have these tools in their hands. And these people are still responsible for them, as we said. But now people talk about AI will take my job. So the radiologist, the doctor, they might be sitting there saying, okay, for now, I'm making decisions, but this thing is running really quickly. There's going to be a point where people are no longer going to need me. They're just going to go to their AI doctor that's going to give them everything and it's going to be able to make the decisions. So, nobody's going to need doctors anymore. What do you think about that?
That's a great question. And I'll like maybe unpack it in a couple ways. So
Mhm.
I think even you mentioned it like a couple of minutes ago where we were talking about how, AI helps in clinical decision support. And you mentioned that you're still going to want to hear the news from the doctor
Doctor. Yep.
in the sense that there's something deeply personal about healthcare that AI cannot replace, in the sense that there are some elements of healthcare that are delivered at the bedside, where there's like things that systems and tools and tests and AI cannot capture, and requires, like, I think, clinical judgment that AI cannot replace. And more importantly, there is the human aspect to healthcare that we definitely need humans in the room for.
Mhm.
And the important thing there is new residents and new sort of providers are getting trained to work with tools such as this. They understand the limitations, the benefits of using these tools in their workflows and where they can, to the point where they can start like assessing where to use AI versus like where to really rely on their clinical judgment. So, for example, all of the test results for an individual may be completely normal and baseline, but the individual might still not be feeling well. And that's detective work that a human on the ground can see and observe and feel and do, and not something that AI, based on like the markers that it has access to, can like assess.
Mhm.
Having said that, though, like there are areas where AI is going to be much better. Right? There's a growing sort of corpus of information that doctors have to rely on and providers have to rely on, which is all of your like cutting edge research that is going on, clinical trial outcomes. And AI is inevitably better at looking at all that information at once and assessing and providing you access to the right information at the right time. But what to do with that information, how to apply that to your patient really varies on a case by case basis. So that's what I mean by like healthcare is deeply personal. So that's like one element of it. In that way, we do believe that like there's always going to be need for doctors.
Mhm.
Severally, there is a increasing shortage of physicians. And I think at this time, getting AI integrated into workflows is going to be useful only to keep us at like the level that we are at today. So
Mhm.
with the shortage that is predicted in 2030 for doctors, AI is really just going to barely get us there. So we're hoping that AI can like kind of fill that gap that is going to be left behind by not that many clinicians being available. Um, and I think the nuance here is that, and that's sort of like further bolstered by the fact that wherever AI has been deployed, especially in like community hospitals, safety net hospitals, the workload that AI has taken off of people's plate has quickly been replaced by something else.
Yep.
And AI is only, I think, helping people do better with what they have, but it's not kind of really removing the need to do certain tasks, at least yet.
Mhm.
So even in our own workflows, if you think about it, if it was taking me like an hour to like read through all of the emails on a topic and then synthesize and write like the next steps or figure out the plan. It's not eliminated the need yet to do that synthesis, add in the additional context that I have that AI doesn't yet have access to in the form of data that it's not able to access right now. Maybe because it's not on my system, it's with another person, whatever the limitations may be today. It's not fully eliminated tasks. And wherever it has eliminated tasks, it has been quickly replaced by something else. So that's, I think, another way to think about it, especially in underserved areas where the doctor to patient ratio is super, super high in the sense that one doctor is looking at 20, 30 patients a day. If you give them AI, they're probably going to go home at a reasonable time, but it's not going to really like drastically change the shape of whether they're needed or not and whether like
Mhm.
the hospital needs less doctors or not.
Yeah, that makes sense. The point you were making about the fact that we're heading towards shortage, to some extent, we're sort of lucky that AI came because, we would have hit that shortage and not have solutions. And now we may have a solution that will make the shortage less bad. There's a show on HBO called The Pit. Have you heard of it? Any
I've
chance?
heard of it, but we try not to watch healthcare shows at home because my husband is a physician. And it's a little depressing to watch with him because that's my life.
Yeah.
Those are my patients. And I'm like,
Yeah.
okay, well, I
Yeah.
didn't sign up for that job. So
Yeah. Yeah. Valid point. The point I was gonna it's valid.
it's a difficult job. It's not an easy job to for bad news.
Yeah, the whole thing. Yeah, the delivering bad so in the show, The Pit, so season 2 just ended, and they very intelligently weaved in the hardship of being a doctor, and specifically an ER doctor in their case. with AI coming into the picture. Now, also specifically in this season, they had there was a cyber attack, so for a while their network was down, making it even worse. But their point was the human touch, the fact that humans need to do the work, they need to do things with patience is always there. AI may be able to help because and through the season, the doctors need to record their notes. They need to write,
Nice.
every patient, what they came in with, what was the problem. And you can see how they don't have time to do this. So they end up after the shift exhausted typing notes. And the idea that AI comes into the picture and at least that thing that is really, really hard, that is at the end of the season, and then the end of the, not season, the end of the shift, AI at least can come and help and help you at least go to, go home, go to bed. You're still doing your full shift. You still need to deal with all these things and the
Right.
stress and the human and delivering the bad news and all that. But at least AI lets you go home after the shift instead of stay another hour. And you can see them there. They're trying to write the notes and they're falling asleep. Um, I have a question for you that was not on the list
Okay. Let's do it.
that we'll see. I don't know. Maybe you have something about it, maybe not. So in in the space of healthcare and making leveraging AI to provide better service, one of the challenges that I identified at least is the challenge of bringing all the data together. So, for example, I have I think 7 different my charts,
That's
across
great.
different providers because they're each one a John Muir and Stanford this. Stanford has 2 because there's Stanford Children and Stanford Regular, and so one of my kids has both. Well, actually, both all 3 kids have both of them.
I did not ask you to offer this information, by the way. Let it be known that this information, you volunteered this information.
Sure. Yeah. Yeah, I did. So, there's that. And then of course, everybody, maybe not me, I've got a regular watch, but everybody has all these smartwatches and everything. So there's data being collected by their phones and stored. So Google Health and all that. And so data is everywhere. And then we're saying, okay, we want to give you better service using AI. So when you get to the doctor can give you better service. But data is everywhere. So how do we deal with that?
That's a great, great question. And one that we think about a lot. So if I could read that back, your question is like,
Yeah.
does data infrastructure and data fragmentation in healthcare needs to improve for AI to truly scale?
Mhm. Yep,
Great.
pretty
Okay,
much. Yeah, that's exactly what I asked. Yeah. That's a
great.
better way of phrasing it.
The short answer is yes. The long answer is also yes, but there might be a little bit of like silver lining here, wherein I don't believe that we need to like solve all of the data fragmentation problems and challenges that we face in healthcare today for AI to truly work, which is where like that I'll go back to that idea of like thinking about workflows, trying to find a piece of the pie that you can really start focusing AI efforts on before trying to solve the full puzzle or the full landscape. So in healthcare, there is that like sort of system fragmentation where things are in different structures and in different systems that are not compatible with each other. Your specialist has a different, EHR system, your primary care has a different one, and then I have a couple for my kids, and then your parents maybe, and whoever
Mhm.
else you're a caregiver for, your partner for a full household, there's probably like, to your point, like a solid, like double digit number of systems that you have to manage. And if
Mhm.
you think of this from like a provider's lens, if you're a nurse or a doctor in the emergency room and a patient has suddenly presented themselves, being able to get all of this information together without having to have that long triage conversation with the patient, like what's your family history, what is your history of whatever symptoms that you're presented with, or all of that is like valuable time in ER that you want to use differently. And that is a problem. So that is definitely something that needs to be solved. But it also needs to be solved responsibly, right? In the sense that like offering information to a lot of people are in fact like having conversation with Gen AI tools, trying to provide it with as much information as possible and trying to get a sense of like what Gen AI thinks your new WebMD sort of source. So in that regard, I think there is progress, but it's uneven progress, which is like largely driven by people offering up their own data and connecting systems where I think a couple of EHRs actually allow you to integrate some things,
Hmm.
and largely
Yeah.
depends on like it's patient driven, as it should be, like kind of
Yeah.
patients offering their data, but it's not uniform. You cannot like kind of build something that is built on like missing pieces of information that will not be like kind of regularized across all of the patients that show up. Then there's like this idea of like temporal fragmentation, where there are sources of data that can, in some cases, offer like a full picture of someone's healthcare utilization. So it's claims data where you're getting services and you're filing claims with your insurance provider to get reimbursed or
Hmm.
get the appropriate sort of coverage as is dictated by your benefits. The problem with those data are it kind of misses that like sort of clinical context, which is
Hmm.
it just has like this person presented for this kind of service, and then this is the service code or diagnosis code
Yeah.
associated with it, and then here's the how much we typically charge for it or negotiated rates, and then that's just that piece of the puzzle, and not like all of the sort of rich contextual information that can help you build really really good sophisticated systems that help predict a person's health outcomes over time, in a like sort of 360 way, right? And the other problem with claims data is that it's lagged. It's 30 to 90-day lagged, like in the
Hmm.
sense that as claims are being filed, adjudicated, fully paid out, things can change. There's a negotiation happening between your provider institution as well as your insurance provider to make sure that um, that everything is like kind of as per the contracts of what is covered in your benefits and at what rates and all of those details. So this is also like there's work there, but just really like solving this problem requires structural change in ways in which healthcare is offered. And even then, like you're never going to be able to like kind of in some ways get then every patient to then opt in to say, and here's all of my variable data as well, and here's all of my other data as well. So there's that missing piece there. And then after all of this, there's this like semantic fragmentation, which is even if you pulled all of this data together, you built a tool today, Yami, where a patient can go in and build their own sort of database of their household's like healthcare
Hmm.
information. There is this non-trivial task of like semantic fragmentation where clinical notes are processed and read differently with different nomenclature from claims data. And like there's this provider difference in how they're thinking about things, writing things, applying their clinical judgment. And so that's like that requires like NLP pipelines and heavy lifting, and that is not something that like is very easy to do with for an individual either themselves or even if there was a tool built for everybody to kind of look at themselves. So I think that's there are all of these nuances, but the good news is that understanding the problem already gets you halfway, because then you realize you don't need to solve all of the problems to drive change and make a positive impact and build useful AI. So this is where really being thoughtful about what is the piece of the problem that you can solve, but then also think about what your data can helpfully let you do and reliably let you do, and what it cannot. Understanding drawbacks of your data is actually more important than understanding the value of it in some cases, because then it like really makes you make the right sort of all the right problems with these data, right? Then you're not like trying to over indexing on an incomplete picture of someone's healthcare utilization or incomplete picture of whatever it is that your data paints the picture for you. At the same time, you can still the idea is to like kind of build, but make improvements in the data infrastructure, like not accepting defeat in the face of a complex data problem, and continuing to make like sort of meaningful incremental progress towards it, but not that being like a blocker for meaningful AI impact.
I didn't think how complicated it was actually until you went through all that right now. It's I think the point you're making is you can already make impact with the silo data. So for example, let's say I go to a doctor that I don't have any prior relationship with the group that they're a part of. And they don't know anything about me. They don't have any of the other data that's coming from any of the other my charts and in my phone and whatever. And so they're going to ask me a bunch of questions, right? They're going to be like, oh, your parents, how are they doing? Any diseases in the family, et cetera. Like they're going to build that full thing. So they're going to try to build an understanding. And then what you're saying is we can apply AI based on that, what was collected in that session. And then obviously the information about what I'm complaining about, what I came for, why. And so there's this, so if you're building an AI solution for that, you need to consider the fact that you're lacking most of the data. And so you need to collect that data. So instead of, because AI wants to be very certain, AI wants to say, I know what it is. So you're saying we need to think about building AI that understands that some of the data is missing and figures out how to, grab maybe what's missing through the conversation and then still doing its work, but understanding that limitation. And at the same time, thinking about the structural problems of how can we bring the data together, assuming the individual approves. And as far as I'm concerned, bring all the data together. Like if it gives me better service, go to all the my charts. Hate logging into so many my charts. And I do it, by the way, for ChatGPT. I go and I download and I download and I download and I download and I
Right.
upload it all into chat. So if and I notice that some of them can connect, but some people may say, yes, share all of my data across all of these service providers and give me a better picture. And the point that I'm learning from you now is you need to consider these alternatives. When you're building AI solutions, you need to consider the fact that some people you'll have virtually no data about, some people you'll have more, some people will want to share across the different EHRs, and some people will not. And even if they did share, it doesn't mean that you can just straight up understand it the way that it is because to your point, the semantics, they are still different. It's a really big problem.
Yes, but the good news is that even in your example, right? Like, so you presented with a set of symptoms, or for
Yeah.
example, you have a lab, but
Hmm.
maybe your lab is the only piece of information that your radiologist has about you, and maybe like
Yep.
whatever was collected in the session that you had, or like your 10-minute session with your
Yeah.
provider that you had. Um, but the good news is that you're not the only person who has ever had to get that lab, for
Hmm.
example. So there is a
Yeah.
very rich data set that another one of our portfolio companies, Meredith, has built that kind of pulls together all of these images and builds a really nice training set for these types of clinical systems that then build confidence in that slice of the problem, not the whole workflow, not, you know, kind of using your full breadth of your medical history to predict your healthcare outcomes, but for that very narrow size of your encounter with the healthcare system today, it can be very, very good, even better than like sort of that radiologist sitting by themselves trying to find minor changes. Like I'm not a radiologist, I'm not an expert, but the system can perhaps like help the radiologist make better decisions and find those nuanced differences in your labs. The other thing that I want to pull on that you mentioned was there's fragmentation and everybody is not going to be like comfortable in sharing that data. But at the same time, like you have to realize that for AI to work well enough in clinical settings, it should at least have the same amount of information that your physician has. So if your
Hmm.
physician doesn't need, like, at that point, if somebody presents at an ER, all of their medical history up until that point, and they just need to kind of treat that patient for whatever elevated labs or whatever markers that they're kind of demonstrating at that time. I with the same amount of information perhaps would make like an equally good judgment that and perhaps help parse more information that is available in like the clinical corpus or other research data systems and assets that are available out in the world and help the clinician make fill in the dots in those ways. So I think we are very quick to look at AI systems and be like, oh, it's like not doing well enough because it doesn't have all of this other data that it could have had and it could have done so much better. Yes, the answer to those things are all yes, that it could have. But in the current setting, at least it will perform well enough and slightly better in aiding the physician with all of the information that they need access to in making that clinical decision. Because it's like an information processing problem, right? They have to look at a wide variety of information, new research, outcomes from clinical trials, things that are not like always top of mind. Yeah, it can like quickly help catch in conversations, in literature, and just like kind of it's a system and can process information much faster, and it doesn't have the mental burden of like 20 other patients who are presenting with similar problems. So there's also like that fatigue doesn't impact AI in those ways.
It's as we're going through this conversation, so I had a lot of episodes like this, right, talking to people about AI influencing things, and I think this is one of the places. Just thinking about the conversation of the past 40 minutes or so, it's one of the places I'm most optimistic about. I'm most excited about because, and I'm not in the health space, but as you might have noticed through this episode, I tend to take my health seriously and maybe a bit too much sometimes. But the impact on humans, the impact on humans who are the patients, but also the impact on the clinicians who are providing the service, because it's really hard being a doctor, being a nurse, being radiologist. It's hard. It's long hours. To your point, you need to stay abreast of everything, every new idea that somebody has and published a paper. You need to know if it's relevant to your space. So,
And on that point, I think that's why I think in that clinical space, writers are very, very optimistic about this as well, because they want to offer the best possible care to their patients. That's how they got into this space. So they're like,
mhm,
give me whatever tool that like can help make my life or my patients' lives even slightly better. I will take it. I will try it.
yeah,
But I think the responsibility sits with us and individuals like kind of building these types of tools, interacting with them to build tools that are actually intuitive to these individuals who are motivated, excited, optimistic to use these tools, but want don't want to interact with like black box systems, don't want to interact with like some random SHAP value, and really want to know like, okay, now what do I do with this information at 2 a.m.? How reliable is this information and what it's missing that helps them make better decisions?
yeah, yeah. It makes sense, and I can see how they're excited by it. Um, This is great. This is fantastic. So I know we're towards the end of the episode. Usually I ask multiple questions at the end, but I'm going to ask you just one question, and it's not an easy one. But and we'll wrap up this really really interesting episode. Think 5 years ahead. Where are we in AI supported healthcare? Like where we talked about all these great things today. What do you think is already going to be in place and maybe even natural to us 5 years from now versus maybe what is still going to be in development and maybe not yet there?
That's a really good question and really packed, to be honest. But few things that are I think are going to be true regardless of like 5 years, 10 years. Like we're still going to need clinicians and we're still going to need providers. And that's where I'll start because AI is going to help them, but healthcare is deeply personal.
Hmm.
I think all of us will agree that we need a human in the loop, not just to take the liability or like that sort of accountability of the actions, but also to feel more comfortable, to feel like healthcare is actually working for us in some ways because there's so many interesting intrinsic sort of elements of how care is delivered that AI can't fully sort of map the grounds on. At the
Hmm.
same time, I do believe in 5 years, AI will start to get embedded more deeply into clinical workflows in ways that simplify lives for clinicians, for providers offering care. And right now, we're in this like sort of phase where we're having very, very important conversations about where AI should be adopted, where it's making a difference, whether in clinical settings, do we have the right incentives for clinicians to use AI? Is it leading to changes in how services are being billed, being provided? Is it improving outcomes? In 5 years, my hope is that all of this has been streamlined a little bit, the dust has settled, and it's not an afterthought. It's not oh, we're doing this cutting edge thing. It's a part of like the way we work. It's embedded. It's less like kind of experimental at that point. What that also means is for us to get there are conversations that are starting to either mature or really take shape in terms of like how the next generation of providers are being trained to incorporate AI not just in like their training, but also AI in the way they sort of approach patient care. And they're starting to rely on their clinical judgment, and they're starting to rely on AI where it makes sense for them to do so, but it becomes like an extension of their clinical judgment and not like if then else sort of a situation for them. Things that I imagine would still be maturing, and that kind of brings us to like that next generation. I think we've all been talking about hardware. We've seen it with like our own wearables, that there's immense promise in how AI can really shape with all of these data being collected and even more devices being um, developed actively, which we'll all enthusiastically buy, um, how we can sort of start integrating some of that into that holistic view of the patient, which is, I don't think it's a problem that will like fully be solved in the sense that there is going to be data fragmentation, and data interoperability is like a big focus for all of us here in healthcare. So hoping that the needle would have moved on that, but it would, I'm sure that we would have like started walking on that journey of 1,000 miles, but like kind of moved the needle forward in some ways. I want to be cautiously optimistic. I'm very optimistic there, but cautiously
Mhm.
so, because it's like people's healthcare data. It's HIPAA secure. There's
Yeah.
like a lot of like safeguards that are in place, and with safeguards that are kind of now being developed at local levels instead of like national or um, global. So that's probably going to be like a little bit of like as we did with the EU Data Privacy Act and all of that. Like
Mhm.
there's going to be a little bit of like navigation. Is it a problem that won't be solved in 10 years? I don't think so. I'm very optimistic, but it is definitely going to be something that are that is going to start becoming more forefront for all of us. As to your point, we're already doing it, but as we start like maturing our use of and reliance on Gen AI powered tools for our personal healthcare navigation and journeys, thinking about our data more cautiously is going to be one area that's going to become more forefront. I don't even, and with the world that we're in, maybe all of this happens next year, Yanni, in which case we will meet again and chart the
Yes.
coast again, or, you know, we'll be surprised. I've been positively surprised by the pace of innovation that is happening in this space. So
Yeah.
better days ahead.
I think that's the ideal way to end our episode, with that level of optimism. I'm looking forward to those experiences, and I'm looking forward to you and Morgan Health being, one of the leading organizations driving this forward. There's going to be a great benefit to society and humanity, I think, through this journey. With that, Preeti, I really, really want to thank you for your time. And to the listeners, remember to subscribe and like, and whatever button you can click on that is positive on the platform you're listening to this to, please do so. And we will see you at the next episode. Thank you. Bye, Preeti.
Bye.